House, Cambodia. Today, I'm very happy to share all of you about the best practice of safety workplace during COVID-19 pandemic in Cambodia. For my content, I would like to talk about the first situation and impact of the COVID-19 pandemic in Cambodia. Second, committee response to the COVID-19 pandemic. Third, response to the COVID-19 pandemic by Ministry of Labor, Vocational and Training or OSA. The last one is challenge and the way forward. The first one, situation and impact of the COVID-19 pandemic. According to the World Matter on 8 June 2022, in the global, the total data of the coronavirus case is 536 million case. For the case death is 6 million case, and the recover case is about 507 million case. In Cambodia, the total coronavirus case is 136,000 case. For the death is 3,056 case, and for the case recover from the coronavirus is 133 case. Since May 2022, we don't have the new case that infect from the coronavirus. For the impact of the COVID-19, as you know, COVID-19 pandemic has affected the global economy, and growing crisis is hitting developed country not only as a health emergency like in Cambodia, has affected all the sector, especially tourism, construction and manufacturing for the export. Like in 2021, 489 factory has been closed temporarily during the COVID-19 community outbreak, and about 398 worker has affected from the COVID-19 community outbreak. For the tourism sector, 17,000 tourism workers are unemployed, and the Angkor Wat ticket sale were down nearly 100% during the COVID-19 outbreak. In Cambodia, we had the National COVID-19 Committee chaired by Prime Minister, and the Provincial COVID-19 Committee chaired by the Provincial Governor. For the Ministerial Committee chaired by the Minister of Health with Secretary of State, and for the technical working group to set the criteria to close or reopening the factory after the COVID-19 outbreak. For the OSA response to the COVID-19 pandemic, Ministry of Labor, Vocational and Training ensured the announcement on the prevention and control of the COVID-19 at the workplace for enterprise, owner, worker, for overseas worker and vocational institute. We give the training of prevention and control COVID-19. We totally get 570 factory, and the worker, the candidate that joined the training, the totally is 100,000 worker, and we do the training to trainer to 25 provincial department of labor for prevention and control the COVID-19 that we cooperate with the GIZ Fabric Asia, get 160 candidates. For the in In 2020, Ministry of Labor, Vocational and Training cooperate with the Ministry of Health, prepare for the 3 quarantine center and health checkup, 10 center for the worker who went to their homeland during the Khmer New Year Day to prevent and control the COVID-19. This picture is about the training on prevention and control COVID-19 at the workplace to the Provincial Department of Labor officer, and we go to training to the site at the factory to the worker how to prevent and control the COVID-19. For other response to the COVID-19 pandemic, Ministry of Labor, Vocational and Training participate for the COVID-19 vaccination campaign that cooperate with the Ministry of Health and cooperate with the Royal Cambodia Armed Force for injection COVID-19 vaccine to the worker and Cambodian people. We get the total about 590,000 people. In those, 130,000 is our worker and 460,000 Royal Cambodian people that vaccinated by the Royal Cambodian Armed Force. Department of Occupational Safety and Health organized the training on work improvement for small construction, and we include the training of the prevention and control COVID-19 to provincial labor officer, enterprise owner, manager, and employee in the provincial like in the Posak province, Battambang province, Kampung Thom province, Kampung Cham province. For other response to the COVID-19 pandemic, Ministry of Labor, Vocational and Training, and issued the announcement on prevention and control of COVID-19 at the workplace for enterprise owner, worker, overseas worker, and vocational institute. Ministry of Labor, Vocational and Training start the dissemination campaign of the COVID-19 prevention measure to the enterprise and worker in the collaboration with the Ministry of Health, WHO, and ILO. Ministry of Labor, Vocational and Training launching the guideline on prevention and control of COVID-19 for vocational institute. And on January 2022, Ministry of Labor, Vocational and Training has an operating procedure on the operation and management of the factory in the new normal. The standard to be highly effective and respond to ensure the business production chain sustainability and maintenance of work and income benefit also. And Ministry of Labor, Vocational and Training supporting payroll contribution to the worker during the lockdown. And Ministry of Labor, Vocational and Training support the payroll and cost to the worker for the factory that suspend temporary. For one worker, we give the $40 per month, and for employer give $30 per month to the worker that work in the factory that suspend temporary. This slide is so about the Ministry of Health, Ministry of Labor, Vocational and Training, and The government give the payroll to the worker that affect during the COVID-19 pandemic to help the worker and their family also. This slide is all about the vaccination COVID-19 in Cambodia. For now, the population for the people that injected COVID-19 vaccine is about 94% if we compare to the population 16 million people. For the last one is, I would like to talk about the challenge and way forward. Our challenge is we lacking of human resource such as occupational hygienist, occupational physician, occupational specialist, and toxicologist. We didn't have the toxicology lab. We don't have the OSA training and research center. We let's cooperate from the employer and employee side, and the number of OSA inspector is limited. And the last one is because of the COVID-19 outbreak, labor inspector has declined. For our way forward, our vision is all the workplace create and promote preventative safety and health culture in the Kingdom of Cambodia. And our mission is providing adequate OSA protection and training to all workers, assisting all workplace in establish effective occupational safety and health management system. And we continue to extend OSA protection to the SME, IE, and agricultural. Second, we reinforce OSA language framework. Second, improving reporting system of occupational accident and disease, strengthening labor inspection. Four, increase special program to control hazard occupation, child labor, infection disease, and drug use. Thank you for your attention.